So my name's Tamer. I'm first and foremost, I'm a doctor, a clinician. I've been involved in sort of clinical medicine since 2010, and my interest, both as an undergraduate and as a postgraduate, has been in this kind of interaction between exercise and nutrition predominantly, but then as the years have gone on, about all of these other fads and trends that fall under wellness as a sphere, but have a lot of sort of evidence base and a lot of science behind them. And part of my role within Phycore, both as the founder, but also I don't do much clinical work, I'm kind of just the overseer as it is trying to sort of make sense of what is a whole, every month we get sort of an influx of new information, new trends, often coming from kind of Central Europe or from the US, of what people want to do, want to know about. And part of our sort of role as clinicians is to try and filter out fact from fiction. I'm going to talk to you about that with exercise. Both the benefits of exercise, which there's kind of, I could spend years talking about that, but also the dangers of exercise and how current trends play into that. And then in the second half of this kind of very short talk, biohacking, but really more focusing on the human upgrade, which is this concept that's come about. And it focuses on a few main things. It focuses on kind of simple principles of healthy living, and then how you can tailor that to genetics, and then also this new word that has come out in the past sort of 10 to 15 years of epigenetics, so how environmental influences can switch on or switch off certain genes that are good or bad for you. And please stop me if you have any questions. So prescriptive medicine, I mean, this is one of my favorite I have a little picture of this in my clinic room. There was a famous American cardiologist who said that if there was one tablet that he would prescribe to everyone to cure nearly all disease, it would have been exercise. And what has happened over the past sort of 50 to 70 years with increasing pharmaceutical presence in clinical medicine is that preventative or sort of non-pharmaceutical interventions have taken a back step, and as clinicians we are less involved in that, and that's often handed over to therapists, to physiotherapists, to kind of occupational therapists, to a number of different sort of skill sets, but basically we don't take much responsibility for that. That was the big change with Phycore. With Phycore I was kind of seeing a number of patients who was saying, I have such a good relationship with my doctor, why can't we extend that relationship to involve all of my sort of lifestyle interventions that I want to get sort of, set up in place, but also I want to start doing in a sustainable manner. There was a wonderful article in 2015 by the Royal Academy, so just to give you an understanding, in the United Kingdom you've got the Royal College of GPs, you've got the Royal College of Surgeons, you've got the Royal College of Homeopathy, you've got lots of different sorts of Royal Colleges that are regal in their name, and the Royal Academy supervises all of them, and what they did is they put together a whole sort of host of research, and they came out with this wonderful document that was entitled Exercise is the Miracle Cure. And it talked about how there was a benefit in exercise in nearly every disease, so we're talking about anything from heart failure to dementia to depression to anxiety to all sorts of things. The only thing, interestingly, that exercise doesn't have a great evidence base is for weight loss. And I won't go into that in too much detail here, but it is a very interesting phenomenon that we as clinicians find, is that actually when it comes to sort of initial weight loss, 65% of the British population are overweight, that actually it's nutritional and psychological interventions that have the biggest part to play at the beginning. And if you want to ask me about that, we can talk about that later. I'm not sure I've got the scope today to talk about it. But also the fact that kind of the data and the evidence base is becoming increasingly integrated into the wellness industry, and I'm hearing a lot more about people who don't come from a basic science or a clinical background, who kind of talk about studies, whether it's HIIT training for cardiac rehab or yoga therapy for dementia in the elderly, how they're talking about how these interventions they believed in, they've been focused on, they felt has this bigger role in society, has now got their own sort of evidence base. And if you can't tell, us doctors are obsessed with that word, evidence base. But then what are some of the dangers? This is also one of my favorite slides that I present. We've got, I remember when I was 14, 15, giving away my age, there was not really any such thing as HIIT training. There was resistance training, there was cardiovascular training, there was the interim of the two if you did boxing or gymnastics, but there wasn't really this concept of going to a gym and doing a HIIT class, then going again at the end of the week and doing another HIIT class. And I talk about the benefits of some of these trainings. So HIIT had a very interesting study in cardiac rehabilitation, the last thing you'd think of doing to someone who's just had a heart attack is to put them on a HIIT training program, but some joker in the US did do it and showed that it had better outcomes than just putting someone on a standard treadmill. And it just goes to show in medicine we think we know what the answer to things are. I was just recently asked to write an article about smoking and vaping. I don't know if you know, but lots of doctors encourage patients to start vaping to switch off from cigarettes, but now there's a lot of concerning data about vaping. So in clinical medicine, we definitely don't get things right all the time. We try and function off the information, the evidence that we have at the time, and often 5, 10, 15 years later you look back and you're like, maybe that advice wasn't so great. But what I will leave you with, and this is kind of what looks like a very young crowd, is that HIIT training, super HIIT training, ultrathons that have kind of really risen into the forefront of something that everyone wants to try and get under their belt do have their dangers and do have their concerns. The big concern about HIIT training is cortisol, persistently elevated cortisol levels that can have kind of a long-standing effect on the body. I'm going to speed up a little bit. That kind of features into the dangers of overtraining and also restorative exercise. The analogy I always give to patients and clients is that you get one body, which is akin to getting one car. If you spent £1 million on a vintage Ferrari, the dream, you have that vintage Ferrari for the rest of your life. You really have to use it on the vision that you're going to be able to drive it in 10, 15, 20, 40, 60, 80 years' time. And one of the big issues you see here on the left-hand side, both of these people are quite unhealthy. Whilst they might be pro athletes, what they're doing to their bodies is quite unhealthy and is not sustainable. They won't be able to carry on in either shape or form for the next sort of 10, let alone 20 years. And then of course the last thing, which is there's been this huge rise in the use of performance drugs, both in sports medicine, but also just outside of sports medicine. Probably the biggest thing that I get approached in the gym, being a doctor, about is the use of anabolic steroids or kind of male hormone therapy. And it is a big thing. It has its risks, it has its dangers, it also has its benefits. Growth hormone, which is the commonest one that's being used, has been used in injuries and kind of rejuvenation, anti-aging we heard about earlier. It's a very popular phenomenon in the US, but it has its dangers and it's something to be aware of.